Hello, and welcome to our fourth annual Prenatal-to-3 Research to Policy Summit. I'm Cynthia Osborne, and I have the privilege of directing the Prenatal-to-3 Policy Impact Center here at Vanderbilt University. Thank you all for joining us today. For many of you, it's your first summit, and for most of you, you've been to at least one before, but there are some of you who have been with us for all 4 years. And I truly appreciate all that you do to support children and families. And I think it's important to gather and recognize all the progress that's been made to strengthen supports for our littlest ones and their parents. Most of us have become familiar with the overwhelming science that tells us how important it is for children to live in safe, stable, nurturing environments in the earliest years to spur healthy brain and body development. And our mission at the Policy Impact Center is to share with you what rigorous research tells us are the most effective policies that states can implement to create the conditions in which all children thrive from the start. We have worked with many of you this past year to evaluate states' policies and programs and estimate the return on investment of a particular policy or calculate how your policy choices will affect families' resources, to illustrate how states across the country are funding or implementing a given policy, and to translate the complex research findings into language that allows you to make evidence-informed policy decisions and to advocate on behalf of young children and families in your state. Nothing makes us happier than being a resource for you, and I invite you to reach out to us and let us know how we can be helpful to your state. So over the next 90 minutes, we are excited to unveil findings from our new 2023 Prenatal-to-3 State Policy Roadmap. The roadmap is a guide for state leaders on what works to improve outcomes for children in the earliest years. And we go beyond informing you just on how children in your state are doing, and we provide clear evidence-based guidance on how they can do better. We're going to celebrate the tremendous evidence-based investments in children that states made this past year and the advancements in research that allowed us to add community-based doulas to our roadmap for the first time. We're also going to hear from special guests from Minnesota, North Carolina, and Vermont, who helped their states usher in major policy wins for children and families, and who will help us to understand not only what they did, but how they did it. But first, we are lucky to have Governor Walz from Minnesota welcome us today. Minnesota is a state that literally transformed its system of support for children and families this past year. So welcome, Governor.
Hello, everyone. Minnesota Governor Tim Walz here. Welcome to the National Prenatal-to-3 Policy Summit. I often say, don't tell me your priorities, show me your budget. And the budget I signed into law shows Minnesota's unwavering commitment to children's well-being. From establishing a paid leave program to ensure no parent is forced to choose between caring for a family member and a paycheck, to creating a nation-leading child tax credit, reduce childhood poverty by up to 1/3, to feeding every single student free breakfast and lunch at school. Our state is building a system of support to make Minnesota the best state in the nation for kids and families. In Minnesota, we're carving out a corner of the country where no child goes hungry, no community is left behind, and nobody gets told they don't belong. And thanks to the hard work of folks like you gathered here today, we'll continue to tackle the complex social, economic, and health needs of our littlest ones. I'm grateful for the partnership. Enjoy your summit.
Well, the children of Minnesota are certainly lucky. It's so impressive. Now, by the end of our time together today, I hope you walk away with 2 primary takeaways. First, state policy choices matter. Your policy choices can truly make the difference between a child living in poverty or thriving, a family having access to healthcare or going without in a time of need, a child being hungry or well-fed, or a parent creating those nurturing connections with their child or being stressed and unable to engage with their newborn. So just let me repeat my first takeaway. Your state policy choices matter. And second, you are doing it. Wow, 7 states fully implemented 9 evidence-based roadmap policies for the first time this year. And that number doesn't even consider the numerous states that expanded benefits and made substantial investments in the effective roadmap strategies. This has been a big year for children and families. But the work is not over yet. And to be honest, there are some states that have more work to do than others to support children in these important years. Now, before I get into the roadmap findings, I always like to begin by sharing why it is that we do this work. Why do we focus on the prenatal to age 3 period of development? Well, all of our work is based on the science of the developing child, which clearly shows that beginning prenatally up to age 3 is the most rapid and sensitive period of development, and that it lays the foundation for all subsequent health and well-being. At birth, our brains are expecting input from the environment around us to shape our understanding and our interactions with our world. Now, we're not born a blank slate, but you can think of a brain as a supercomputer that is expecting to be programmed. The level of plasticity of our brains really peaks in this prenatal to 3 period. And after age 3, our brains and bodies have to work much harder just to learn new things. In those first 3 years of life, inputs from our surroundings shape and strengthen these neural pathways that in turn affect all of our developing systems. Decades of science tell us that safe and stable, nurturing environments with limited exposure to adversity form neural pathways that emphasize good judgment and patience and perseverance. But the science is just as clear that prolonged exposure to stressful environments codifies neural pathways that emphasize fear and distrust and survival, and they really damage the other developing body systems. Babies are born with incredible potential, but our earliest environments influence whether we all meet our potential. And stressors on children's developing brains and bodies in these earliest years can lead to struggles across the life course and have serious negative consequences, not only just for the individual child, but for our whole society. And when this happens, we have literally failed our children. So again, as I said, our work builds on the science of the developing child, which clearly spells out the kinds of environments that children need to thrive. And we operationalize this science into 8 prenatal to 3 policy goals. The idea is that if each state can achieve these 8 goals, then all children will live in environments that promote healthy development, and our whole community and country will be better for it. So the 8 goals include ensuring that families have access to the resources that they're eligible for, that parents can work and care for their children, that families have sufficient and stable resources, including food security and housing stability and economic security, that our babies are born healthy to healthy parents, taking into consideration both their mental and physical health, that our parents have the skills and knowledge of their children's development to allow them to engage in those nurturing interactions with their children that we know are so important to promote healthy brain and body development. And that when our children are not with their parents, that they're also in those nurturing environments. And importantly, that we're able to identify any developmental delay that a child is experiencing and get them the services that they need to get them back on track for optimal development. So in our roadmap, we provide a set of outcome measures that are aligned with each of these 8 goals, which can help you see where children and families in your state are doing well and where they're lagging. And you can use this information to prioritize the specific goals that you may have for your state. These outcome measures illustrate that there is wide variation in the extent to which children are exposed to healthy or stressful environments. And the race and ethnicity of infants and toddlers and the state in which they are born are huge predictors as to whether the children will be exposed to nurturing and safe environments or stressful and low-resource environments. So one example is being born preterm or before 37 weeks. Being born preterm is a strong predictor of numerous adverse conditions, including things like neurological disorders and asthma and hearing loss, and even infant death, as well as cognitive delays and anxiety and depression as the child ages. The data show that our nation's Black babies are 1.5 times more likely than our white or Hispanic babies to be born preterm. And the variation across states is even larger. Babies born in Mississippi are nearly twice as likely to be born preterm as are babies born in Vermont. And another key example is poverty. Living in poverty, especially chronic poverty in these earliest years of life, has been linked to countless negative outcomes across the life course. It's from poorer health and worse educational outcomes, lower employment, engaging in riskier behaviors, you name it. And in this country, Black children under the age of 3 are more than 3 times as likely to live in poverty as are white children, and Hispanic children are more than twice as likely as white children to live in poverty. And these racial and ethnic disparities in the earliest years really set the stage for inequities across the life course. And the variation across states in child poverty rates is substantial. So in Arkansas, Louisiana, and Mississippi, New Mexico, more than 25% of children under age 3 lives in poverty, whereas less than 10% of our infants and toddlers live in poverty in Vermont, in New Hampshire, and North Dakota. And these vast differences in outcomes by race, ethnicity, and across states are the direct result of policy choices. Now I'd like to share the story of a stylized family that we've created to illustrate just how much your state policy choices matter. As I said earlier, one of the key points I want you to leave with today is an appreciation of how important our state policy choices are for supporting children and families in these earliest years. And as we all know, many families are struggling right now. 3 big crises have been in the news nearly every day for the past few months. The Medicaid unwinding that began last May has pushed over 7.5 million people off of Medicaid, which includes 1.6 million children. And a large majority of these folks were removed from the rolls due to procedural issues, not because they were no longer eligible. Also, as you know, the first round of federal stabilization dollars recently ended for child care providers, which is leading to closures and families struggling to find care and fewer resources spent on helping educators earn a decent wage. And I think all of you saw that child poverty doubled in 2022, following the end of the enhanced federal refundable child tax credit that supported millions of families during the pandemic. And what each of these crises has in common is that it's the result of policy choices. And collectively, they demonstrate how important the choices that we make are for supporting children and families. So take, for example, the Medicaid unwinding. Minnesota, Colorado, and Oregon passed legislation this year to prevent families from being disenrolled for procedural issues, which allows children and families to continue accessing life-enhancing, life-saving care. And in childcare, states like New Mexico and Vermont and Louisiana have created permanent funding streams to support childcare and offset the loss of the federal dollars. These state policy actions lead not just to more children in high-quality care settings, but also gets parents back to work and earning the resources that they need to support their families. And poverty, well, many states have been providing state child tax credits and expanding their earned income tax credits as a way to counteract the loss of the federal tax credit. With these resources, caregivers can be better equipped to provide their children with food or housing and safe care environments. State policy choices really do make a difference. Now, we've created this story of a stylized family to illustrate how your state policy choices intersect to provide a basic level of support for families to care for their children. I want to share with you the minimal level of resources that a mom, who we'll call Lena, has to provide for her infant and toddler based on the state in which she lives. To allow us to compare all states in the District of Columbia, we've created some assumptions for our family. So first, Lena is a single parent with an infant and a toddler, and she doesn't receive child support. She works full-time at a job that pays the state's minimum wage. And she took off from work for 12 weeks following the birth of her infant, who was born on January 1st. And this is the parental leave that's allowed under the Federal Family and Medical Leave Act, or FMLA. To allow her to work, her children attend a child care center that charges the 75th percentile of the state's market rate survey. And her toddler remained in care while Lena was on parental leave so that she wouldn't lose her spot. And she's one of the lucky ones in her state to actually receive a child care subsidy to help her offset the cost of care. And she was able to actually secure slots for her children in a center. And finally, Lena receives the nutrition benefits that she's eligible for, and she files her tax return so that she receives any credits that are available to her. So let me begin by showing you the resources that Lena has available to her if she lives in the District of Columbia. DC's minimum wage is $17 an hour, and therefore, if Lena worked full-time all year, she'd earn over $35,000. But remember that she just had a baby, so she took off for 3 months of family leave. Unfortunately, in DC, they have a paid family leave program that limits the loss of her earnings during the time she's off of work to heal and to care for her new baby. So rather than losing 3 months of her annual earnings, or over $8,000, she only loses approximately $800 in wages, thanks to the generous paid family leave benefit that covers 90% of her wages for 12 weeks. But to allow her to work, Lena has to leave her children in care. Child care for her 2 children would cost her over $43,000 a year, which would leave her nearly $9,000 in the hole if she had to pay full price. But because DC reimburses providers at a rate that covers the actual cost of care, and Lena is fortunate to have access to a child care subsidy, her annual out-of-pocket child care expenses are less than $900 in copays. Now we can add in the federal nutrition benefits that she's eligible for and her federal tax payments and credits, and you can see that her annual resources increase by more than $10,000 from $33,000 to about $44,000. And finally, we add in Lena's state tax payments and credits to see the total level of resources available to her, because DC has a generous state earned income tax credit and a child care and dependent care tax credit. Her total annual resources to provide for her 2 children are actually more than $47,000. And she's also eligible for Medicaid. If Lena lives in DC, she has more resources than she would if she lived in any other state. But the variation across states is huge. In 16 states, Lena would have over $40,000 in annual resources to care for her family. But in 18 states, she would have less than $30,000, despite working full-time. If Lena lived in Georgia, she'd have the fewest resources to provide for her children, and she would not be eligible for Medicaid. The differences between DC and Georgia are driven largely by the higher minimum wage, the paid family leave, the lower out-of-pocket child care expenses, and the generous tax credits in DC. So let me show you what I mean. Georgia's minimum wage is the federal minimum wage of $7.25 an hour. And working full-time all year, Lena would earn just over $15,000 a year. But because she took off 12 weeks to heal and care for her new baby, her earnings are reduced to just $11,600. Georgia doesn't have a statewide paid family leave program, so any time that she takes off following her child's birth is actually unpaid. But to work, she must leave her children in childcare, and if she had to pay the full price for childcare, it would cost nearly $23,000 a year, which is impossible to pay on her earnings and would leave her over $11,000 in the hole. Although she is fortunate to have a childcare subsidy, in Georgia, the subsidy reimbursement rates are low, and they don't cover much of the price of care at the 75th percentile. So after paying a copay and fee, Lena has less than $2,600 left of her earnings. Not many of us would think working full-time was worth it in those circumstances. The federal nutrition benefits and tax credits provide almost $18,000 in resources to Lena, but Georgia doesn't provide any additional benefits. So therefore, Lena's minimum annual resources are just over $20,500. This amount is just not enough to meet their basic needs. And it's unfair to someone who's working full-time not to be able to support their family. I hope Lena's story really helps to illustrate how your state policy choices matter. The higher minimum wage in DC means that most of Lena's resources come from her earnings. Paid family leave and low out-of-pocket childcare expenses protect her earnings, and tax credits supplement them to allow her to provide for her children. In Georgia, Lena loses nearly all of her earnings to childcare, and most of us in her situation would either not work or we'd leave our children in much less expensive care and perhaps lower quality childcare. The federal benefits she receives are generous, but just still not enough to help her adequately provide for her children. Lena's stories illustrate how state policy choices combine to ensure a minimal level of resources for families, which has a huge impact on child and family outcomes and community well-being today and over the long term. We've created a similar story for each state, and you can find it in your state summary, and you can also see how your state compares to other states in our U.S. roadmap summary. As I've now said many times, state policy choices matter, but I also understand that state leaders have to make tough choices to use scarce public resources wisely. And as researchers, we wanted to provide you with the best evidence on how to use scarce resources in a way that will make the biggest impact on strengthening children and families. So we began by reviewing the most rigorous evidence available on dozens of state-level policies to let the evidence guide us toward what the most effective policies are that states can implement to meet at least one of the 8 Prenatal-to-3 policy goals and to help children thrive from the start. I invite you all to read our comprehensive evidence reviews that are available in our clearinghouse so that you can see how we landed on the 12 policies and strategies that are included in our roadmap. In short, after reviewing thousands of studies on dozens of policies, the 12 that we include in this roadmap are the only 12 that have strong evidence to support that they work. We honestly did not start our research with any particular policy solution in mind. If the research told us that eating a spoonful of peanut butter each day was what would help kids, then that's what would be on the roadmap. But unfortunately, that particular policy seems to need further study still. But the 12 roadmap policies and strategies, they include a combination of broad-based economic and family supports, including increasing income eligibility for health insurance, a paid family leave program of at least 6 weeks, a state minimum wage that's at least $10 an hour, and a refundable state earned income tax credit that's at least 10% of the federal credit. The roadmap also includes more targeted interventions to meet the specific needs of families, including reducing administrative burden so that families can access benefits they're eligible for. And we focus on SNAP because it's the most robust nutrition benefit in this country. Also, comprehensive screening and connection programs such as Family Connects or Healthy Steps, child care subsidies, which we know are so critical at this point to allowing families to work, group prenatal care such as centering pregnancy, community-based doulas, our evidence-based home visiting programs that focus on parenting practices, early Head Start, and early intervention services. We don't doubt that states are implementing policies and programs that are important but just haven't been evaluated yet. In fact, we have a whole team that's devoted to conducting original research and evaluations to learn more about what it is that works. And we're following every rigorous study that's being conducted because we want to continue to build the evidence base and to share with you more options to improve outcomes for infants and toddlers. But for now, we have confidence in these 12. In fact, we added community-based doulas to the roadmap for the first time this year because new evidence from rigorous randomized controlled trials shows that when women, particularly women of color, were offered a doula who was someone that they trusted from their community to support them during their pregnancy and labor and delivery and postpartum period, the women had better birth outcomes. They engaged in more nurturing parenting, and it led to enhanced child health and developmental outcomes, such as breastfeeding initiation and safe sleep practices. And we continue to review the growing evidence of policies and strategies that are already on the roadmap. For example, this year, new research shows that access to paid family leave leads to a 12% reduction in infant mortality that occurs after the baby is 1 month old. That is a huge finding. I invite you to review our entire roadmap. And although you get extra credit if you read the entire thing in one sitting, It's actually meant to be a resource or a guide that you can turn to as you need it to help you make evidence-informed policy decisions. For example, you may want to know which policies are most effective at improving birth outcomes, or you may need the most recent data on child poverty or developmental screenings in your state, or you want ideas of how other states are funding doulas or home visiting programs, or which states successfully enacted a paid family leave policy so that you can learn from them. It's all in there and more. And you can get a quick snapshot of your state's progress toward implementing each of the 12 effective solutions in your state summary. And we provide a complete overview of the policy progress of all states in our US roadmap. But the real information is in our longer profiles of each policy and strategy. In each profile, you can learn more about the policy, how it impacts infants and toddlers and their parents, the progress that states have made toward adopting and implementing it, the key policy levers that influence how equitably the policy or strategy is actually implemented, and the variation in the generosity and reach of each of the 12 roadmap policies and strategies. I also invite you to reach out to me and my team with any questions you have on your state's information, to invite us to present your state's roadmap to any group that you think could benefit from learning more. Remember, our whole goal is to be a resource for you as you make evidence-informed policy decisions to strengthen children and families. As I mentioned, the other thing I want you to take from this event is an appreciation of the impressive state policy wins this past year. And we're fortunate to have folks from 3 states joining us today to share what it is they did, how they did it, and what's left to do. Today, we're joined first by Allie Richards. She's the CEO of Let's Grow Kids in Vermont. And this year, Allie and Let's Grow Kids, along with their 40,000 supporters who make up Vermont's child care campaign, made a history by passing the impressive 2023 child care bill into law. We're also joined by Matt Gross. He's the Assistant Secretary of Government Affairs at the North Carolina Department of Health and Human Services. Matt was integral in the years-long effort that culminated in the successful passage of the Medicaid expansion bill in North Carolina this year. And finally, we have Deborah Fitzpatrick. She's the Director of Policy and Research at the Children's Defense Fund of Minnesota. Deborah led her coalition's work to build support for and advance a statewide paid family and medical leave policy in the state of Minnesota, which was one of many impressive policy wins in Minnesota this past year. So welcome to all of you. Allie, I'm going to start with you. Vermont had a really remarkable year for childcare. Can you just take a few minutes to tell us what it is that you're most proud of, but also how did you do what no state has done before, which is to pass a payroll tax to establish a permanent funding stream to support childcare?
Thank you so much, Cynthia. It's great to be here and with Deb and Matt as well. I love the sharing that happens nationally with other states and accelerating each other's work. So as you say, the 2023 Child Care Bill in Vermont, affectionately known as Act 76, there's so much to be proud of, honestly. The process, the result. One of the things I want to point out is the extreme bipartisan nature and support that we received for this major investment, as you say, first of its kind. Payroll tax, sustainable funding revenue. It will inject about $125 million a year into childcare. And again, just to put it in perspective, Vermont's a very small state and our budget is only, about $5 billion. So $125 million is absolutely game changing for childcare in Vermont. What I mentioned bipartisan, I think this is a strength of this issue. We had Democrats, progressives, independents, Republicans, and even the sole libertarian vote for this bill and then vote for the veto override to make it the law. And that's just really significant. And it was an incredibly important piece of the puzzle I think we can all share across our states and show what happens when this gets done. And the other thing I'm incredibly proud of is the business support. As you mentioned, a payroll tax. that's no small matter. I think we all around this screen and audience knows what to do for kids. The science is pretty clear. How do we then move the money around to really make it happen on the ground for childcare infrastructure? And it was the business community. We have over 300 top business leaders in Vermont engaging in this effort as top experts and champions and advocates. And they were able to bring that alive. Look, we know it's a trade-off. We know it's hard anytime we're talking about affordability and raising taxes. But in this case, it pays for itself, and we're going to prove it. And what they were able to say is, immediate return on investment here with, our employees, with engaging the workforce. And, beyond that, this is how we're all going to benefit as taxpayers. Actually, we're going to make Vermont more affordable, not just for people with young kids, but we're going to really increase our labor participation. We're going to increase sort of our tax base. We're going to increase our revenue into Vermont. So they could prove it on every level as business leaders, which was incredibly critical when you were talking about revenue. So I'm proud of a lot of things. The last thing I'll just mention is 40,000 people. We have a population of 650,000 in Vermont. We had over 40,000 Vermonters actively engaged to create the political will to make this a reality in Vermont. So I'm really pleased to be here and talk more about this with you all.
Wow, it's really impressive what you did. And to put that number in perspective, that was really helpful to think of how many folks that is, 40,000 to join you in that campaign. Wow, congratulations on that. Matt, North Carolina had a very big win this year as well. Expanding Medicaid in a state that required far-reaching bipartisan support is not something that we see every day. So how is it that you got this done?
Well, thank you for having me today. I will try to summarize the last 7 years in 4 minutes. But it was quite a stacking of hands over a long period of time. I'll say, I think the effort started really strong when our current governor, who's finishing his second term, it was a campaign issue for him, obviously. But when you have a governor who's of the opposite party of the legislature, that's not always your best pathway to success when that becomes a signature issue. We were really fortunate in 2017. We had some really strong, moderate health chairs on our House side that were actually willing to put forward a bill that wasn't called Medicaid expansion, but was essentially Medicaid expansion. Included some elements that I think we recognized weren't things we would put in our own bills, such as work requirements, premiums, but things that the Trump administration was approving. And, we took the strategy of, if we're going to keep this conversation going, we can't try to shoot this down because of some elements we don't like. So we worked with those bill sponsors to start building some momentum. And I think what was really important there is we became one of the few states in the country that had Republican bill sponsors that were health chairs that were pushing for expansion, which got a lot of national groups paying attention in North Carolina. So that really injected a fair amount of money to a lot of our nonprofits, who then were able to do a fantastic job building not only grassroots and grass tops as we think of them from the state level, but also local grass tops, who were really essential in winning the hearts and minds of legislators across our 100 counties. As the efforts continue, what we saw for a long time in the polling was, for a little background, our legislature's on Jones Street. So what I would say is Main Street, North Carolina was there, but Jones Street had to catch up. And so helping legislators understand that their communities and their constituents, particularly in fairly red districts, still really wanted Medicaid expansion, but was an effort that a lot of the nonprofits, what they were able to do with building those local grass tops was get the folks that are connected to legislators to say, hey, if you get behind this, we're gonna support you. There were some other important policy shifts that happened. We shifted our Medicaid program from fee-for-service to managed care. And while I don't think that was in any way programmatically necessary to do expansion, that was sort of a signature that our Republican legislators wanted on the program. So doing that first gave them an offer to say, hey, an off-ramp to say we changed the program. Now we can expand it. But I'll say one of the things that became so impactful, and this is why I say this is a stacking of hands. We were doing roundtables across the state to build this momentum, but we got to a point where some of the nonprofit groups that had built networks of over 150 business supporters, they started getting really conservative county commissioners to pass resolutions in favor of expansion. So it's one thing to have a poll, and you can question the way the poll was constructed. But when I was able to walk around our legislative building, showing them resolutions passed by counties that sent some famous names like Madison Cawthorn to Congress saying, we want Medicaid expansion. That opened the eyes of a lot of legislators. So then obviously there's the policy work and a lot of education happened on the policy side, but that constant building was important. The other thing we parlayed was some of the opportunities that COVID presented us. There was a signing bonus that was included in one of the COVID relief packages that equated to about $1.8 billion for the state in one-time money. Additionally, there were some other financing rules around hospitals that we could parlay to do with expansion to draw down incredible amounts of money so we could come up with a package that between expansion, this hospital financing piece, we could get $8 billion of federal money on a recurring basis to support healthcare in North Carolina coming out of a global pandemic with a $1.8 billion signing bonus on top of that. So it got to be where the money was too much for people to look away from. We then were able to negotiate some other healthcare items that had been long-standing changes around certificate of need and other things that some of our legislative leaders wanted, and parlay that all together into a package that, say, was 7 years in the making and a lot of ups and downs. But one of the things that stood out to me is why the long haul was worth it. When our president pro tem, who was one of the biggest opponents of expansion, finally flipped and had a big press conference unveiling the bill, a lot of the things that he was saying, I could draw a straight line back to conversations that our former Secretary Mandy Cohen and I were having with him in 2019. So you can see the conversations we had stuck. We didn't see the bill until 2023, but we never gave up. But had the way I describe my roles, I got to be the quarterback of an absolutely incredible team that really built a ground game around the state and got this across the finish line. It has opened up a lot of exciting opportunities for North Carolina to provide much stronger services for children and families.
Well, congratulations, Matt. It's really amazing. One, the kind of consistency between some of the things that you were saying and what Allie said, that it did take a long concerted effort, but it was broad-based. You had support kind of all over in all your counties, as well as from the business community. And it sounds like you were able to show that it was going to pay for itself. And so those are some pretty important takeaways from that. Thank you for sharing that. So Deborah, as your governor said, Minnesota had a big year. It became the 14th state to adopt a statewide paid family and medical leave policy. But you also established a child tax credit. You increased your access to childcare and your funding for your early learning scholarships and just numerous other things. And I want to hear from you. Before we do, however, your lieutenant governor has provided a wonderful video that summarizes the great work in Minnesota from this last year. So welcome.
Bonjour, welcome to the National Prenatal-to-3 Policy Summit. My name is Peggy Flanagan. I'm the Lieutenant Governor of the great state of Minnesota, and I'm an enrolled member of the White Earth Nation. I'm also a mom. I often say that the biggest raise I ever received was when my daughter started kindergarten. When I was a kid, access to childcare allowed my mom to go back to school, get a higher paying job, and pull our family towards the middle class. I've seen the power of pathways like childcare assistance firsthand. This year, we created almost 27,000 additional childcare slots. We passed universal paid leave because no parent should have to choose between spending time with a newborn or caring for a loved one and a paycheck. We provided direct checks to Minnesota families and implemented a nation-leading child tax credit to cut poverty by 1/3. You might ask, how in the world are you getting so much done in Minnesota? Well, it was the product of years of organizing, years of relationship building, and years of believing. Decades. That's how long Minnesota has been fighting for this. And we're just getting started. I'm grateful for the important work you do each and every day on behalf of kids and families. Gichi miigwech. Thank you so much.
Well, it's great to hear from your Lieutenant Governor. Deborah, tell us more. How did you really get so much done this one session?
Yeah, thank you, Cynthia. Great to be here with all of you, with Allie and Matt. I'm going to build on, have a lot of similar themes to the ones that Matt and Allie shared. But I first want to emphasize what you all did, right? We know this was an incredible group effort over a decade, as you just heard from the Lieutenant Governor. And we had a beloved U.S. Senator, Paul Wellstone, that died in a plane crash several years ago. And he had a framework that has since been dubbed the Wellstone Triangle, which I think is well encapsulated in some of the comments that Matt and Allie also made, that in order to make big changes that improve people's lives, you need smart, well-crafted, research-informed, shovel-ready policy, which I know folks in this group can appreciate, grassroots community, and I'll add coalition organizing and electoral politics. But since I only have a few minutes, it's very hard to talk about all of those wins. I'm going to focus on paid leave. And I'm going to start with organizing and talk about persistence in the face of long odds. And I think that was also something that came through. We built an incredible coalition over a decade that hung together, worked through challenges, and grew even when it seemed impossible to pass a bill. For early childhood advocates, it was incredibly important for us to recognize the diverse needs of families and young children, to advance a comprehensive policy that included medical leave and family caregiving leave in addition to parental leave. That allowed us to fully engage a huge range of organizations and interests, from the AARP to small businesses, and develop an incredible bank of compelling storytellers across those diverse needs. Those stories helped everyone, legislators, and also including members of our own coalition, see and, more importantly, feel how important it was to keep going on both a personal and professional level, again, even when it seemed like this would never happen for us. We also hit on our country's history of intentionally creating uneven safety nets, as the governor mentioned in his opening remarks. And that was really important, this idea of not repeating history, of leaving no one behind. It was really critical in passing one of the nation's strongest, most inclusive paid family medical leave programs, as well as many other less visible changes in how state government supports families, which maybe I can talk about a little bit later in the next question, because I don't have a lot of time. So on to smart, well-crafted, research-informed, shovel-ready policy. The first year of our decades-long fight, we couldn't get the policy done, so we funded a Minnesota-specific study to ground the policy going forward. Then ran a bill year after year, even when it was unlikely to cross the finish line, holding mock hearings when we couldn't get a real hearing. This helped us create trusting relationships with policymakers and our state agencies and make the bill stronger and better, incorporating the research and experiences of so many. So you researchers and trailblazers in other states, this win was yours too. And Cynthia even testified in Minnesota one of those years, pointing out this hole in our Minnesota roadmap. So thank you, Cynthia, for playing your role. Finally, electoral politics. We inserted paid leave in the election process since we know how popular and effective it is. Many legislators had run on the issue and heard on the doors how very important it was for young families. So when they got to the Capitol, it was a much easier sell. We made sure paid leave showed up in debates, in town halls, in advocacy group questionnaires. And for many in our coalition, this work was done in a C3, nonpartisan, educational, research-based way. Control of our Minnesota Senate hinged on 350 votes in one district. I bet you can guess what one policy issue was that was part of that now senator's platform: paid leave. I'll stop there.
That's amazing. And again, having to find those folks, those partners to come along with you and get that broad-based support. I could just listen to all three of you talk about what you did and how you did it. It's just impressive to hear how you each work so strategically to make these huge investments. And it's also clear that none of the policy work that you do exists in a vacuum. And the number of stakeholders who have slightly different sorts of goals that you had to make some sort of trade-offs with to be successful. But just to see how you're all filling out the system of care for families in your state is just so impressive. So Allie, I want to come back to you. So Vermont, like we said, is the only state so far that's implemented a payroll tax to fund childcare. But payroll tax is a pretty common way to fund paid family and medical leave programs. And as you're thinking of the future, do you feel like your state's open to using this approach for other policy goals your state has? Or what sort of trade-offs might you have to make as you move forward? Kind of where do you go from here after this big win?
Well, our great hope is not just for Vermont, but for the rest of the country, that when we make investments like this, we have the resolve to see them through, to measure their impacts in every dimension, from child outcomes to our economic impacts that we know we will receive. And so that will hopefully give us the momentum we need to solidify those investments and encourage long-term thinking, longitudinal planning, multi-year budgeting, right? Prevention. Because the whole point of everything we're all talking about here is, do we have the courage to put capital up front, knowing it's the right thing to do for our outcomes, and it's also the smart thing to do for our investments, including state revenue. It's very hard to move money around. We're all stuck in one-year budget cycles. I don't know about you all. In Vermont, we have one-year budget cycles, but in Vermont, New Hampshire, we actually have two-year political cycles. We actually reelect our governor and our legislature every 2 years. So there is no incentive to do the long-term preventative work that we know saves us down the road in heartbreak and money. And so that's been our job, to prove that point, which is why the business community has been so paramount. And I love hearing how parallel our journeys have been. You know, the politics matter, the policy matters, you know, they all sort of feed each other. The advocates matter, that grassroots network, and for us, that business. So for us in Vermont, you know, there's just no doubt you need public investment to fix these key issues. I hope we have all made that clear now. We made a modest investment through a payroll tax. In this case, it was a 0.44% payroll tax split between the employer and the employee, because both will receive deep benefits from this. And so what we plan to do is to monitor our progress in real time, both on the number of childcare spaces that have been increased, the number of women in the labor force participating, the number of new workers, the number of young families coming to Vermont. We have a demographic crisis that this is one of the things that is a key, way to solve that. So, we truly believe that this level of systemic reform and doing it responsibly will be a motivation for us to start thinking about that, and in other areas. This is how we do social change. You have to have a grassroots network. You have to understand that politics is a dimension. You have to do this sort of system transformation that goes upstream and gets you a great return on your investment in a human capital and a real economic capital way. An investment like childcare, we believe, can break that open, because it really releases a pressure valve on our finances. And then you can start discussing these other priorities that also take revenue. It really unlocks a lot of capital. And we plan to show that and have that be an accelerator and example for other states. So we're very hopeful that this will unlock future investment. And I will tell you, a beautiful thing about doing childcare is that a lot of the champions we helped elect to pass this bill are systems thinkers, complex problem solvers. And that will serve us well, not only in fixing a complex system like childcare, but all these other issues we care deeply about that just require some more, frankly, long-term planning and some fortitude, some real political courage.
Well, as a researcher, it really warms my heart to hear you talk about how accountability, or that might not be the right word, but just the idea that you're going to be tracking what this really means for families in your state, and you're going to be able to demonstrate that these investments are paying off. I think that is just so smart and strategic, and obviously something that we'll be watching quite a bit as you guys move forward. And I also really like the way that you talk about this system, and that thinking about prevention and building this kind of system of supports that take investments over the long haul. And kind of, Matt, as you are thinking kind of going forward, you have these Medicaid allows for you to do things that you may not have been able to do without expanding it. And I just there are lots of states that rely on Medicaid to fund other early childhood initiatives like home visiting or early intervention, group prenatal care, doulas. As you move forward, does North Carolina plan to use Medicaid more in these ways? What is it that you're going to do to continue to kind of build this system of support for families in North Carolina?
Sure. Thanks for the question. So, I think first off the top, one of the things we're excited about here in North Carolina is we have always had a Medicaid program that has been viewed as one of the best ones to be in and one of the hardest ones to get into. Even for parents, the income eligibility was 44% of federal poverty, which equates to, depending on family size, about $9,000 to $10,000 a year of income. So we're going to have this whole new group of parents that are going to receive a suite of healthcare benefits for both physical and especially behavioral health that they've never had before. So we're excited about that. Also look at the way this impacts a lot of our other initiatives. For example, we know there continues to be an early childhood workforce crisis that I fear is going to get much worse before it gets better. And while benefits are a replacement for a good wage, we know that one of our highest populations of uninsured working folks that are going to benefit from expansion are our child care workers. And thinking about that, those pieces are really important. But looking at specific Medicaid investments, there's some other things that we got done this session, including increasing the maternity provider reimbursement for bundled payments to get closer to the Medicare rates. We're also looking at implementing some additional coverage of doula services. In addition to the service coverage, also looking for using some Medicaid funds to engage with community partners to implement doula services and expand the number of sites providing group prenatal care. Also, some doula supporting for training, promotions, and doula engagement. Additionally, we're going to do some add-on services for group prenatal care. The other big things we did in the Medicaid space, one is around our foster care population. So we have kind of a unique setup with these what are called LME MCOs. They're sort of these quasi-governmental behavioral health plans, and they serve the foster care population. We were able to also get past this session a statewide child and family specialty plan to really focus on the unique needs of this vulnerable and sometimes transient population. So very excited to get that also tied into and negotiated with our budget. Additionally, as I mentioned earlier, with Medicaid expansion, we're able to trigger this quote unquote signing bonus. One of the interesting things with the signing bonus is, without getting too technical, it's tied to an FMAP increase of the existing Medicaid population. In other words, we save state funds. So it's really just state funds they can invest on anything. And the governor here, Governor Cooper, put out a $1 billion behavioral health spending plan and actually got the legislature to agree to over $700 million of that. And some of those pieces are also going to really touch on the work we do with children, including funds for crisis stabilization, specifically for families and children at our state behavioral health facilities, significant investments in child welfare and family well-being behavioral health investments, building out a much stronger crisis intervention system, including mobile crisis teams. So we have fewer children that are stuck in EDs and can get the crisis services they need. Also a significant impact in behavioral health rates. So we can hopefully get a much more robust behavioral health service provider network, both for children and families. So a lot of opportunities that we're looking forward to taking advantage of in the upcoming years. I know our Medicaid team has been working around the clock to implement all of these different pieces and are looking forward to going live with expansion of many of these initiatives on December 1st.
Yeah, that is really interesting to hear. We know about the financial savings that Medicaid provides to states if they expand Medicaid. And we look at the research, so we know how Medicaid impacts family well-being. But to hear you talk about how it allows you to provide these additional services that will really kind of multiply or amplify the effect of merely expanding Medicaid itself, that's really important to think about, of how one policy change can have this ripple effect on so many others. So we'll certainly be watching to see how these kind of myriad things that are going to be happening lead to changes in the well-being of children and families in North Carolina. Well, Deborah, so we've heard all about what Minnesota has done this past year, but can you talk about how you expect these wins to impact the goals that your coalition has set for the state? And like, what is it that you still have to do? What's your next goals? What's going to be happening next session?
Yeah, thank you. Yeah, I mean, I think as challenging as it was getting all these things passed, we know that the truly hard work starts now to implement them all in a way that achieves their promise. You know, it's harder to get support for implementation, to get people excited about implementation, excited to get people to the bill signings, to, you know, get that press. But you know, we know that people are justifiably in some cases skeptical, if not hostile, to the idea that government can deliver for people. Government has too often, you know, been a gatekeeper, reinforcing or even creating that uneven safety net they talked about before, as they make choices about how to implement policies in a fiscally and politically constrained environment. So the promise of many of our policies is diminished significantly when only a small percentage of eligible families ultimately receive the benefits, due to everything from reasonable mistrust to, you know, complex, time-consuming deservingness obstacle courses. And we in Minnesota now have this opportunity to build an entirely new state program in the paid leave area, for example. We're also creating a new Department of Children, Youth, and Families. So we do not want to waste this opportunity to create something that works both on a technical level, but just as importantly, or maybe even more so, on a human level, you know, that's grounded in the value of getting to yes for children and families, especially for those that are currently left out. And so we're trying to balance the capacity to do that hard, time-consuming work with the opportunity to make even more progress during this next legislative session. In that vein, we're going to be focused on building on last year's gains in the CTC and childcare arenas, as well as infant and early childhood mental health. We're working on creating a model and to resolve some of the federal interaction issues for periodic payments of a state child tax credit, starting with our new state child tax credit. We know that was a huge piece of the federal policy and its effectiveness. And so we really are going to be focused heavily on how Minnesota can lead the way in solving for that problem at the state level. We're also, you know, hoping to garner some significant piece of an expected but much smaller budget surplus this year to get us on our way to our childcare vision of that 7% affordability standard and well-compensated workforce vision. So we're going to be doing that, and then again focusing on getting some additional resources into that mental health space. We hear over and over and over again how very important that is, and oftentimes not focused on an infant and early childhood space. So we really have some work to do there to bring down some of those barriers. And then finally, I just mentioned it's an election year. As Allie mentioned, our state house is up every 2 years. It's a big election at the federal level. I think we want to do a lot of work to be bringing these early childhood issues forward again in that C3 nonpartisan education research-based way to make sure that people are talking about these issues that are critical to children and families at both the state and federal level over the next year.
Well, it's hard to believe you know, have so much still on your plate given all that you've done, but it's just a long game that we're in when we're really trying to create this system of support. And what's going to be so interesting to see in Minnesota is how all of the policies that you did implement, from paid leave to childcare to the child tax credit, that those are going to work together to really kind of benefit families in ways that if you had only done one, you may not see. We're going to be watching and hopefully making sure that it's evaluated so that we can really provide that evidence to other states that are interested in doing this. There are a lot of states that are wanting to do at least one of those, and the fact that you're doing them all simultaneously will be a really important thing for us to watch. Well, I appreciate so much you sharing all of this, and I wish that we had more time to learn even more about the huge wins that each of you had in your states this past year. Thank you for taking the time to share with us today. And I also invite everyone who is viewing this to go to your state summaries and to read them and to learn even more, because you really all knocked it out of the park, and congratulations. Well, the accomplishments in Minnesota and North Carolina and Vermont are truly impressive. But now I want to take time to recognize all of the impressive work that states accomplished this past year toward implementing evidence-based roadmap policies and strategies. Remember, that second key takeaway from today is that you are doing a lot to support families with young children, and it's important to celebrate it. So first, let's look at how states are implementing the 4 roadmap policies. This past year, 7 states fully implemented at least one roadmap policy, and South Dakota and Michigan each implemented 2 this year. And although there is still a long way to go to ensure that every family has access to health insurance and paid family leave, a minimum wage that's at least $10 an hour, and a refundable state earned income tax credit, states are making great progress. And we need to celebrate really what that means for the well-being of children and families in those states. So let's first look at health insurance. You can see that as of today, because of South Dakota's decision to expand Medicaid, 40 states now have fully implemented Medicaid expansion. Last November, 56% of South Dakota voters cast their ballot to expand Medicaid. And as a result, beginning July 1st of this year, approximately 52,000 South Dakotans were newly eligible for Medicaid. And this includes women who have not yet had a child who can now seek preconception care, as well as those parents whose incomes are between 43 and 138% of the federal poverty level who are not eligible prior to this policy change. And access to Medicaid not only increases access to necessary health care, it also stabilizes families' economic resources, it improves birth outcomes, and it reduces child maltreatment. And as mentioned by our guest, Matt Gross, in March of this past year, the North Carolina General Assembly passed and Governor Cooper signed legislation to expand Medicaid. And it was a major bipartisan effort. And on December 1st of this year, over 327,000 newly eligible North Carolinians will have access to this important resource for the first time. So congratulations to both South Dakota and North Carolina. Your policy choices are making a huge impact on the families in your state. But in addition to Medicaid expansion, states were actively pursuing paid family leave programs this past year. Access to at least 6 weeks of paid family leave following the birth, adoption, or fostering of a child is one of the most pro-work policies that exist, meaning mothers are substantially more likely to return to their pre-birth employer and to be working in the year following their child's birth. It also increases household income and reduces poverty. But access to paid leave also improves maternal and child health and the parents' engagements and nurturing behaviors. And importantly, this year, as I mentioned before, new research shows that access to paid family leave reduces infant mortality. So to date, 9 states are fully implementing statewide paid family leave programs that are at least 6 weeks. And this includes 2 new states, Rhode Island and Oregon, who began implementing their programs this year. Beginning January 1st, new parents in Rhode Island were able to take 6 weeks of paid leave, which was up from 5 weeks in 2022. And just about a month ago, new parents in Oregon were able to begin taking 12 weeks of paid leave. 5 additional states have adopted a statewide paid family leave program, but they haven't fully implemented it just yet. And this includes 2 states, Maine and Minnesota, which we've just heard about, that adopted 12-week programs this year, and they'll both be implemented in 2026. Colorado will fully implement its 12-week program next year in 2024, and Maryland and Delaware plan to fully implement their 12-week paid family leave programs in 2026. And although they weren't successful this year, 23 other states introduced legislation to adopt a statewide paid family leave program, and nearly all of these programs would provide at least 12 weeks of paid leave. So congratulations to families in the 14 states that will have access to paid family leave, and we're excited to see which states next. So state minimum wages that are at least $10 an hour have been shown to have positive impacts, not only on earnings and reducing poverty, but they also improve birth outcomes and they reduce child maltreatment. And it's important to note that $10 an hour is not a living wage and can still leave a family in poverty, but it is the wage that has currently been studied in rigorous research, and it's substantially higher than the federal minimum wage. The federal minimum wage is currently $7.25 an hour, and that hasn't increased since 2009. To date, 31 states have set their minimum wage higher than the federal minimum, and 29 of these states have a minimum wage that's at least $10 an hour. And this number includes 4 states that have passed the $10 threshold this year. Congratulations to families in Michigan and Nebraska, Ohio, and South Dakota. In November of 2022, voters in Nebraska passed a ballot measure to incrementally increase the state's minimum wage to $15 an hour by 2026. And this year, their minimum wage increased from $9 to $10.50 an hour, which equates to more than $3,000 a year for a full-time minimum wage worker. Michigan, Ohio, and South Dakota all had cost of living adjustments to their minimum wages. That's what pushed them over that $10 threshold. But in total, 27 states increased their minimum wages this year. Next year, Montana's minimum wage will also pass the $10 threshold due to a scheduled cost of living increase. But every other state that's not over that $10 threshold, with the exception of West Virginia, whose minimum wage is $8.75 an hour, every other state is at the federal minimum wage of $7.25. And if every one of these states increased its minimum wage to at least $10 an hour, nearly 2 million workers would benefit from a wage increase. But if you look at the top end of that spectrum, already 5 states have minimum wages that are over the $15 an hour mark. And there are 10 other states that are going to be over that $15 mark by 2026. So on to tax credits. Similar to paid family leave, we saw a lot of legislative activity related to tax credits for workers and parents. Now, because they're relatively new at the state level, the current evidence base doesn't really say enough about the impact of state child tax credits on prenatal-to-3 outcomes. However, as of now, 11 states have implemented a refundable child tax credit, and numerous states are working to make them even more generous. And we're certainly interested in growing the evidence base for this policy. The research is clear, however, that a refundable state earned income tax credit for working parents that is at least 10% of the federal credit promotes work, improves financial stability, and it improves birth outcomes. Based on our benefit cost analyses of a state EITC for both, we did it in Pennsylvania and in South Carolina, we found that the return on states' investments were substantial, up to 7-to-1 within the first year. So currently, 22 states have fully implemented a refundable state earned income tax credits that are at least 10% of the federal credit. And these 22 states include Hawaii and Michigan, who met that evidence-based threshold for the first time this year, thereby increasing the impact that these policies are going to have on child and family outcomes. Hawaii made its credit refundable, which means that it will now help workers with the lowest wages. And it also doubled its credit from 20% to 40% of the federal credit. Michigan expanded the generosity of its refundable EITC from 6 to 30% of the federal credit. 3 other states that were already over the evidence-based threshold made their EITCs even more generous for families this year. Connecticut permanently increased its EITC from 30.5% to 40%. Maryland increased its credit from 28 to 45%. And Massachusetts increased its state credit from 30% to 40% of the federal credit. And these increases are going to have substantial impact on the level of resources that families will receive come tax time. Also, Montana enacted legislation to increase the generosity of its refundable EITC from 3% to 10% of the federal credit, and that will be available to families in the next tax year. And that's going to push Montana over the evidence-based threshold on the EITC and the state minimum wage next year. And finally, Colorado also enacted legislation this year to increase its refundable credit from 25 to 38% of the federal credit that will begin next year. In Minnesota, they modified their EITC this past year such that the maximum refundable credit is below 10% for a lot of families in the state. But simultaneously, they enacted a child tax credit of $1,750 per child, $1,750 per child, which is the most generous child tax credit that we have in this country. Taken together, these four policies, Medicaid expansion, paid family leave, minimum wage, and a refundable EITC, can provide essential, broad-based economic and family supports that are vital to supporting families with young children. 9 states have fully implemented all 4 of these effective policies. However, in 9 other states, families don't currently have access to even one effective roadmap policy. And as I illustrated earlier, these policies add up to make a huge difference in the level of resources families have available to provide for their basic needs and to help their children to thrive from the start. This past year, we also saw a lot of activity related to our roadmap strategies. Like policies, strategies have a strong evidence base that tell us that they work. However, unlike policies, for which the research is really clear on what the threshold is that states need to meet in order to see the benefits that are found in those causal studies, the research for strategies doesn't provide clear guidance on exactly what states should do or how they should fund the approach in order to take it to scale. However, what we do know, based on reviewing the literature and consulting with experts, are the key policy levers that promote more effective and equitable implementation of the strategies. And we've tracked how each state is doing across each of these levers. In the interest of time, I'm only going to really share details on states' implementation of 2 of our 8 roadmap strategies. One is childcare subsidies, because this was a strategy with the most activity this past year, and community-based doulas, because this is the first year that this strategy is on our roadmap. But I do invite you to review each of the profiles in the roadmap to learn more about states' investments in the other 6 effective strategies. So let's begin with childcare subsidies. Subsidies are an essential part of a system of support for families with young children. As you saw in Lena's story earlier, if a low-income family doesn't have subsidized childcare, they can't afford care and work doesn't pay. And we focus on 3 key policy levers to help make childcare more accessible and affordable to families, which are expanding eligibility, reducing the out-of-pocket costs, and increasing provider reimbursement rates. And this year, states made huge progress on each of these levers. So first, let's start with eligibility. The federal government allows states to use their federal child care funds to provide subsidies to families who have incomes that are at or below 85% of a state's median income, or SMI. Currently, 12 states set their income eligibility at exactly 85% of SMI, and 4 more states, New Mexico, Vermont, California, and New York, use state dollars to expand their eligibility thresholds even beyond 85% of SMI. Over the past year, 18 states have increased their income eligibility threshold for subsidies, and 7 states increased it so substantially that they actually met or passed that 85% mark for the first time. But as we know, increasing income eligibility for child care subsidies alone isn't enough to help families access care. The care must also be affordable to families, and providers need to be reimbursed at rates that incentivize them to offer more subsidized slots. Therefore, the second key policy lever is to make childcare more affordable by limiting co-payments to no more than 7% of a family's income. Currently, there are 24 states that set their co-payment rates such that no family that receives a child care subsidy pays more than 7% of their income for care. And there are more states that are moving in this direction. 5 states decreased their copay rates by at least 1 percentage point of a family's income this past year, and several states, including California, Vermont, and Minnesota, took action to drastically reduce their copayment rates in the years ahead. Now, the final key policy lever is that states set reimbursement rates at the equal access target of the 75th percentile of the market. This is a threshold that's recommended by the federal government. At this rate, the amount providers receive for a subsidized slot is equal to or higher than what 75% of providers charge. This amount may incentivize providers to offer more subsidized slots and to pay teachers better wages, and it allows families access to higher quality care. Currently, 23 states set their reimbursement rates at this level or higher for both center and home-based care for infants and toddlers. And this past year, 25 states increased their subsidy reimbursement rates, and 11 of those states increased their rates so much that they now meet or exceed the 75th percentile threshold. Indiana led the way by nearly doubling its rates, and Missouri, North Carolina, and North Dakota deserve special recognition for increasing their reimbursement rates by 35%. But just to complicate things a bit further, rates based on a market rate survey reflect what families are willing to pay, but the rates may substantially underestimate what it actually costs to provide quality care for children and to pay educators what they deserve. For this reason, several states are moving to an alternative approach of using a cost estimation model that calculates what the true cost of care is, and it sets rates accordingly. Currently, DC, New Mexico, and Virginia use a cost estimation model, but this year, California and Minnesota passed legislation to move to that approach in a few years. Now, given that federal dollars that have helped to stabilize the child care market are going away, it's increasingly important that states make policy choices to sustain their investments in child care. There's so much that happened, but it's at risk of going away. But 6 states provide examples of sustainable funding. New Mexico apportions a part of its land grant permanent fund to early childhood. Louisiana gives 25% of its sports betting revenue to an early childhood fund. Washington recently implemented a capital gains tax. And as Allie shared, Vermont just implemented a payroll tax to fund childcare. And in Kansas and Missouri, they both dedicate a portion of their state's tobacco settlements to childcare. And in addition to all the information that's compiled in this roadmap, we recently completed a report that estimates the return to the state on the over $300 million investment that Virginia made to strengthen its childcare system this past year. And we found that the investment paid for itself within a year by increasing employment and earnings within families, which led to increased tax payments to the Commonwealth. Nearly $400 million annually is generated to support the Virginia economy. And this amount doesn't even take into account the substantial returns gained by more children being ready for school, graduating high school, earning more, and being healthier across their lifespan because of these early investments. So now I want to talk about doulas. As I mentioned earlier, we have added community-based doulas to the roadmap for the first time this year. Strong causal evidence of community-based doula programs has demonstrated that doula support increases attendance at medical appointments, it encourages responsive parenting behaviors, it enhances child health and developmental outcomes such as breastfeeding and safe sleep practices. And additionally, there's evidence that participation in community-based doula programs improves important birth outcomes, including lowering preterm birth weight, low birth weight, and NICU visits. And there has been a lot of state activities towards supporting community-based doulas. This past year, more than half of states introduced legislation to support doulas in some way, and 14 states successfully enacted legislation. 5 states newly enacted legislation to provide Medicaid coverage for doula services, which now brings the total number of states to implement this key lever to 12. And among these 12 states, Massachusetts, Minnesota, and Nevada each enacted legislation to substantially increase their Medicaid reimbursements, and the new rate should be effective soon. In addition, 3 states, Colorado, Missouri, and Nevada again, newly provided funding to support the doula workforce, bringing the total number of states that implement this key lever to 8. But because community-based doulas are such an important strategy to support people during the perinatal period, and they have incredible potential to reduce disparities in birth outcomes, we know that we need to devote more time to discussing this effective strategy. So I invite you to join us in just a few weeks on October 31st from 2 o'clock to 3:30 Central Time for a deep dive into community-based doulas. We'll provide more details on the impacts that community-based doulas can have on child and family outcomes, and we'll explore the actions that policymakers have taken to support doulas and expand access to doula care. But you're also going to hear from a panel of experts on state policy choices around insurance coverage, workforce supports, and funding options. Also, the importance of valuing doula voice in state policy-making processes, and the lessons that states have learned from policy implementation efforts. I told you, because of time, we don't have time to go into all of the investments that states have made toward the other 6 effective roadmap strategies. But if you read the roadmap, you will see that there were quite a bit. But I want to provide just a few examples. So in Alaska, they increased their SNAP certification interval from 6 to 12 months. And this is going to make it easier now for eligible families in the state to remain on SNAP. Connecticut, New Jersey, and Oregon are continuing to advance a statewide implementation of the Family Connects Comprehensive Screening and Connection Program. Maryland became the 8th state to offer an enhanced Medicaid reimbursement for group prenatal care. And North Carolina enacted legislation to establish an enhanced rate next year. 11 states successfully enacted legislation to expand their evidence-based home visiting programs. And in Colorado, Maine, and Minnesota, they all made substantial investments in their early Head Start programs. And over the last year, there were several states that took action to enhance their early intervention services. There has been so much going on. So I want to take time now to not only recognize where we've been, but where we're headed. This has been such a big year for children and families in many, many states. And I know there's much more that needs to be done to create this real equitable system of care that ensures that all of our children thrive from the start. But I am really excited about the progress that's been made this past year. And all of you who've worked so tirelessly to make this happen deserve so much credit. And you need to take the time to celebrate the wins. I'm also looking forward to this upcoming legislative session to see what more you have in store. Based on the conversations with many state coalition leaders and elected officials throughout the country, we know that paid family leave and tax credits will be hot items again next year. We also know that states are working hard to figure out how best to support doulas through both Medicaid reimbursements and workforce supports, and that it's going to be necessary for states to involve doulas in this deliberation and policy development process to truly understand how states can be effective. And childcare is going to remain a key issue of concern for most states. States are grappling with how to sustain the investments that they've made these past few years and keep providers and businesses in business, teachers compensated fairly, and families able to afford high quality care. So we will be watching, but we also want to help. We are nonpartisan educators, and our mission is to make sure that you have the evidence that you need to make informed policy decisions. I encourage you to reach out to me and my team to answer your questions, provide you with data or information, present to your colleagues, evaluate your policies or programs, or any number of ways that we can support you with evidence on what works to support children in their earliest years. We're really excited to work with you. And also, as I mentioned, please join us on October 31st from 2 to 3:30 Central Time for our deep dive on doulas. You will not want to miss this event. And you can register for the event today. The link is below on this website, and we will drop it in the chat. And we're also going to be putting out a call for applications for state teams to attend our Policy Academy on doulas next spring. The Policy Academy will allow you to interact with national and state leaders that are making substantial progress in providing doula services, and you're going to leave with an action plan. So please be on the lookout for that call. I would truly appreciate it if you could provide feedback to us on today's event. We want to know what you learned today that will be useful in your work moving forward and how we can be more useful to you. You'll see a QR code on the screen at the end of the event that will take you to a survey. And I promise it should only take you a few minutes to fill out. So please provide your honest feedback. Finally, please use the roadmap. My team has worked very hard to gather updated evidence on effective policies and information on what every state is doing for each of the 12 effective policies and strategies that are in the roadmap. And we want it to be a resource to assist you in your work. As you leave today, remember, state policy choices matter. And so many of you are making a huge difference in the lives of families and children. And I am grateful for all you're doing. I hope you have a wonderful afternoon. And thank you again for joining us today.